It's a very tense time, no doubt, and tense time for decision makers. Council rallied well this morning. It's a tense time for business. We're hearing that loud and clear into our office and through the media that there's a lot of uncertainty around there. And so, as a leader of the community, I feel that too. But I also feel really, really well supported by a council that was very thoughtful this morning, and very well supported by a city administration that really gets it and has been really on top of this and very open and communicative both to decision makers and to the public. And I'm buoyed by my sense of how Edmontonians respond in a crisis. We will be tested by this, but we'll get through it together.
We're taking steps to minimize exposure. While rec centers will remain open, we are limiting programming or eliminating programming, and we're continuing to monitor that situation. We're continuing to take efforts to heighten the disinfecting and cleaning to ensure safety of our employees and the public. Our senior centers will be closing, and we're also working closely with agencies on the senior center side. Our commitment is to our employees and the safety of our employees. It's also to the health and safety of Edmontonians, and we're lockstep with Alberta Health to ensure that any steps that we take are in line with the advice from Alberta Health. We are in an approach that I would call responsive but proactive. So any direction or advice provided by Alberta Health or Alberta Health Services, we are prepared and we will action accordingly.
We'll work to support calm and support our community to be resilient through what will be a very challenging time for families, a very challenging time for businesses, a very challenging time for vulnerable people, and a very challenging time for our employees doing this important work, and for frontline emergency responders and healthcare workers, certainly. So we'll all have a role to play in supporting that calm, and I think deferring to experts and deferring to science and deferring to the best advice of the people in charge of this, which is not politicians, thank goodness, it's public health officials. I think us echoing what those leaders who we've entrusted to help us through crises like this is the best thing we can all do, and that's the approach I'll be taking as community leader.